This is Al Jazeera.
Hello from Doha. I'm Hala Mohideen with the Al Jazeera Newshour. Coming up in the next 60 minutes.
We have outbreaks in multiple countries right now, increasing at exponential growth rates.
A jump in deaths inside China and infections around the globe. The world struggles to contain the coronavirus. As the economic fallout from the outbreak continues, global airlines are being hit hard. Major military deals and commitments towards a trade agreement as US President Donald Trump wraps up his visit to India. And Turkey's President Recep Tayyip Erdogan confirms the deaths of 2 soldiers deployed to Libya.
And global sport continues to be impacted by the coronavirus outbreak, with rugby's 6 nations now under threat. And remembering a basketball legend, Kobe Bryant's widow Vanessa leads the tributes at a memorial service in Los Angeles.
Well, a rise in coronavirus deaths in China and a sharp increase in infections are stoking fears that the global spread of the outbreak is entering a new phase. Iraq has now banned travellers from 7 countries after reporting its first case on Monday. Among the banned countries is Iran. It's confirmed 15 deaths, but has denied reports that the toll could be much higher. Bahrain, Afghanistan, Kuwait and Oman have all reported infections. Now, in Europe, Italian authorities have sealed off the worst affected towns in the north of the country. 7 people have died there, and more than 200 are infected, the highest concentration outside Asia. At least 10 people have died in South Korea, where there are almost 1,000 cases there, and US forces are considering scaling back military exercises. As for China, numbers of new infections in areas outside of Hubei province are falling, but there have been another 71 deaths, mostly in the epicentre. Now, we have correspondents in all the affected regions, from Baghdad to Seoul. But first, let's start with Adrian Brown. He is in Hong Kong for us. Adrian, China is throwing everything they can at this outbreak. Are there any signs that it's starting to come under control?
Well, the death rate on Monday was 71. Now, that is one of the lowest rates we've had for many, many days. So that is the positive. But I think looking at the wider picture, the World Health Organization says that what is happening now is what it fears most, a virus spreading faster than the efforts to contain it. Now, the WHO has said that, it's not prepared to declare a pandemic just yet, but it fears that many countries are unprepared should that scenario happen. And it's that sort of talk that has been unsettling investors across Asia. The Nikkei index in Tokyo opened more than 3% down on Tuesday. Some stocks are being hard hit, like Toyota, the car manufacturer. That's because it relies on Chinese suppliers. And of course, many Chinese factories remain closed, and that is disrupting the global supply chain. But investors are also worried about something else, Hala. China is a driver of economic growth, but it's also got a lot of consumption. Chinese people are big spenders. They have a burgeoning middle class, but that burgeoning middle class simply isn't travelling or spending like they normally would at the moment. But economists also argue that actually, if this virus is brought under control, hopefully soon, then there will be a rebound because of all that pent-up demand. Now, across the border in China, where, as we say, the latest death rate has gone up by 71, there are reports in state media that China might begin testing a vaccine soon. State media reports that a professor at Tianjin University has been testing this virus. He's had 4 oral doses with no side effects. But a lot of experts warn, of course, that, it could be many months before a vaccine is developed. And once it is, there would have to be months of trials, clinical trials, to determine it's safe and, of course, effective.
OK, thank you very much indeed. That's Adrian Brown reporting from Hong Kong. Let's cross now to Seoul, where we can join Rob McBride. Rob, quite a large outbreak in South Korea, but most of the cases are centring around the city of Daegu. What more can you tell us?
That's right. I mean, underscoring the sense of urgency now here in South Korea, the country's President Moon Jae-in has been visiting this Tuesday Daegu. It is at the epicenter of this outbreak. Two large clusters there account for the vast majority of all the cases. He's been seeing for himself the work being done there and echoing the message that we've been hearing from his officials, his ministers, that this week really is a crucial time in the battle to contain this outbreak. The hope is that all these measures put in place will be able to keep the outbreak in this southeast corner of South Korea. But the concern is, of course, that if it fails, and we should know in the next few days, then it's almost as though the government is accepting that this is spreading, that it could potentially be spreading in communities throughout the country. The government has committed more personnel, both military and from the police, to helping in the controlling efforts. But also there we're hearing about a shortage of medical staff, and the medical staff who are there on the front lines in the testing centres and in the highly infectious disease wards really are working around the clock. The country's Prime Minister is now basing down there to try to lead the efforts, and the hope is that the other cases we have seen around the country have been individual ones, but there are reports of a couple of other clusters emerging, one in Busan, which is South Korea's second city, again in a church congregation, 23 victims there, and also in a clinic just north of Daegu, where a total of 22 people have become infected, both staff and patients, and this was out of a total number of, that's a third of the people who were in the clinic, so it gives you an idea of just how contagious this outbreak is. So very anxious days ahead for South Korea.
OK, Rob McBride there in Seoul. Thank you very much indeed. Now, of course, the highest concentration of cases outside of Asia is in Italy. Al Jazeera's Mohammed Jamjoon joins us from near Codogna in the north of the country. Mohammed, just bring us up to date on the latest and just give us a sense of the impact this outbreak is having on people in Italy.
Well, Hala, just in the past few moments, reports have emerged, several Italian media outlets, that there are now 271 cases of coronavirus that have been diagnosed in Italy. That would be another huge spike. Last night, the number was at around 229. Now, that's not exactly surprising considering the fact that Italian officials in the past 24 hours have said that Italian citizens should expect there to be more cases being detected. And they believe that's because there are proactive measures by health officials being taken out to diagnose new cases. Now, just now, we are standing on a road that leads to Codogna. We are in a town called Zorlesco, about 8 kilometers north of Codogna. As you see behind me, there are security vehicles. They will not let cars pass into that area, which is one of these 2 red zones in northern Italy, unless they have permission to do so. In the past 15 minutes, we've seen 2 ambulances emerge from that road heading south, we assume to take patients to hospitals, although we have not gotten much information from the officials here. But it really goes to show just how much alarm there is right now about the growing number of cases. The town of Codogna, as I mentioned, which is about 8 kilometers from where we are right now, that is the center of the outbreak in northern Italy. That is where the first locally transmitted case of the infection was found, a 38-year-old man who works for Unilever. It's not yet known how he caught the coronavirus. There was one person who was suspected of being patient zero here in Italy, a colleague of this man's who had been to China recently, but he had been quarantined and tested, and he tested negative for the virus. So there is a real chase right now in Italy to try to find who exactly patient zero is, how the virus started here in northern Italy. A lot of containment measures being put in effect here in northern Italy. The officials that have been speaking out over the course of the past 24, 48 hours have said that these measures are being put in place because they want to make sure that the virus does not spread anymore. But the thing is that in the past 24 hours, there have also been some tensions that have been rising between the prime minister, who in the last 24 hours had blamed a hospital for the outbreak. And there was another ambulance that just went by. But also you have officials here in northern Italy who interpreted the remarks by the Prime Minister Giuseppe Conte as blaming hospitals in this region of Lombardy, and they hit back saying it was not their fault. So there is some tensions. It's really going to be interesting to see how this plays out at a time when officials here try to contain the spread of the virus, but also when more cases are expected to be discovered in the coming days. Hala?
OK, Mohammed Jamjoon there, live for us in northern Italy. Thank you. Let's cross back to the Middle East. We're crossing to Rob Matheson, who is in Baghdad for us. Rob, more cases are being announced in Iraq, and as in Italy, authorities in Iraq are taking this outbreak very, very seriously indeed. Not just the authorities, but religious leaders too. Just bring us up to speed with what's happening where you are.
Well, we're hearing this morning that there are now 4 cases of coronavirus which have been confirmed in the northern province of Kirkuk. That's in addition to the 1 case of coronavirus which was noted in the western province of Najaf about 24 hours ago. We understand that there are now 13 people who are quarantined in Najaf. That 1 case was an Iranian elderly man who had been visiting the shrine of Imam Ali at the time. We also understand there are 4 people who have been quarantined in Wasit province to the east. And as you said, the Iraqi government now widening the scope of its preparations and its prevention control, saying that people should avoid crowded areas. They should avoid any unnecessary, as they call it, conferences or celebrations. They're also suggesting that Najaf schools and universities should be closed for about 10 days. And they're warning against any domestic travel in and out of Najaf, essentially, not officially, but essentially trying to seal off Najaf, which was one of the primary areas, as I mentioned, for this outbreak. Iraq has also extended its ban to non-Iraqis travelling from countries like Iran and China, but also all the other countries which have recorded cases of coronavirus. Now, this morning, we were down in Tahrir Square here in Baghdad, following calls for a 1 million-person march, which was to have been held to, in part, mark 4 months of protests, 4 months of anti-government protests, which have been going on in Iraq. But the numbers there were very small. We saw perhaps a couple of hundred people who were prepared to demonstrate, but the numbers, as I say, very small. Now, that could have been partly because here in Baghdad, we've had torrential rain. The weather has actually been very bad for the past few hours, but there were also flyers being handed out by some of the organisers of that march, warning against the dangers of the spread of coronavirus and warning people that perhaps they should not take part in the protests for the sake of their health. Interestingly, the leading Shia cleric Muqtada al-Sadr said shortly after that he too was warning people to stop protests to avoid coming together and running the risk of damaging their health. He did tweet that after it became apparent that there was nobody, that very few people were turning up at the protests in Tahrir Square. But one of the things that will be concerning the Iraqi medical authorities is that, unlike in other areas where there appear to have been specific areas of concentration where cases have been found, these latest cases seem to be spread across 3 provinces in the country, and they are quite a distance apart. So they will be watching very carefully to see where the next cases start to develop.
As will we. Rob Matheson, live for us in the Iraqi capital. Thank you very much. Now, Oman and the United Arab Emirates have suspended some transport channels with Iran over the growing number of coronavirus cases there. Let's bring in Asad Beg, who is in the Iranian capital. Asad, we had a lot of confusion about the death toll on Monday. Now we're seeing these travel bans being enforced. Just bring us up to speed with what's happening at the moment.
Well, the latest figures now from the health minister here is that 95 people are infected and 15 people have died. So that's 34 new cases and 3 more dead in the last 24 hours. Now, President Rouhani has been speaking this morning, and he seemed to downplay the spread of the virus, or he's trying to calm people down. Now, what he said was that the spread of the coronavirus is not as bad as the spread of the flu virus that the country has faced in the past. He acknowledged that it was different, but he said that people should follow the health ministry's advice and not panic. But that row, that extraordinary row between that member of parliament for Qom, Ahmed Amir Abadi, and the health ministry continues. Now, that parliamentarian, Amir Abadi,